it was overwhelmingly the phages that tipped me over the edge to come here. It was a very easy decision for me.
The phages are a miracle, in itself. So the phage therapy obviously would be the top priority.
The phage therapy, yeah. That's I think a game changer for treatment, and I wouldn't be surprised if it's not around the world at some point in the future.
Pretty exciting because it's another thing where it's teaching your body, or it's helping your body fight the infection rather than just killing, a blanket number of bacteria or viruses.
I struggled with parasites and like getting better and then coming back, and so I was here about 6 months ago and I had my first phage, and basically I believe almost everything that we worked on is gone. Parasites were always like a number 1 or 2. They haven't even come up.
I had a couple chronic infections that they made a phage for, and even mold that they had made phages for. Pretty clear to me that they worked because this time coming, I didn't have any infections, no viruses, nothing. So it's pretty amazing.
Okay, well, there's a huge difference between traditional medicine and biological medicine. For me and for my body, this is the only thing that worked, period.
First off, I'm not real big into needles or anything like that. So one of the things I like the most is sublingual stuff. And to be able to, take it orally instead of intravenously was a really big plus for me.
So usually with the phage therapy, if they figure out that you have some type of infection, whatever it is, they will identify the strain of bacteria, whatever it is, and they can match your body to a treatment that's going to stimulate the bacteriophages in your body, which is your own infection fighters.
Quite honestly, you take your first phage and you kind of wait to see what happens next. And everyone's kind of different. For me, the doctor told me what he commonly sees, and I kind of fit right into that category. So I had a little bit of brain fog, I was a little tired, but really that was really all that I felt, which for most people in my position, when you do die off from Lyme disease, you're worried about the herx as much as you're worried about the treatment.
They said you might feel tired, and so I was into the second week of it. You take it 30 days, off 30 days. I noticed in the second week that I felt pretty tired by the end of the week, but it's really nothing compared to the benefit of getting better. Yeah, the phage is very exciting.
I'm very thankful for the phages. It takes you from hopeful to this is the real deal. And I felt better in the first 3 or 4 days than I felt in months.
Their goal is to have you be able to live life again. And I'm happy to say that I'm definitely living life again.